What symptoms are related to diabetes and what are the different types of diabetes. Infections related to the skin. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist in the Department of Endocrinology at Ramaya Medical College and Ramaya Memorial Hospital. So today we'll be talking about what symptoms are related to diabetes and what are the different types of diabetes. So the common symptoms patients present to us with excessive thirst, excessive urination, weight loss, and sometimes the patients also present to us with recurrent infections as well. So excessive thirst in fact is because of there is excessive urination. Excessive urination basically happens because there is increase in the blood glucose which is being filtered through the urine. So this carries along with that the water which is present in the body. So this results in excessive urination. Since there is excessive urination, there is excessive thirst as well. But however, in elderly individuals, this kind of a phenomena might not be present. That is, this compensation might not happen, and they can just present with excessive urination, which can result in profound dehydration, because of which sometimes patient present to us in a stuporous or a comatose state as well. So if at all, if the patient has excessive urination and the patient's orientation is declining, then it is important to consult the doctor immediately. So it is even more important to consult the doctor whenever there is excessive urination rather than waiting for the orientation to decline. So along with this, the other symptoms related to diabetes can be due to complications related to diabetes itself. Sometimes patients present with recurrent infections. So if they have recurrent urinary tract infection, recurrent dental infections, recurrent gum infections called as gingivitis, so and also recurrent lung infections, that is pneumonia, again it is important to consult the doctor immediately. Sometimes patients present also with infections related to the skin. So if there are any subcutaneous abscess, carbuncle, furuncle, so that is the infections related to the hair follicle, also the doctor has to be consulted immediately along with the check of the blood glucose levels. So sometimes, as I said earlier, they can present with complications related to diabetes, which can be the chronic complications related to diabetes. That is, sometimes patient present with tingling, numbness of the extremities. So sometimes also patients present with swelling of the legs, facial puffiness as well. And sometimes, very rarely, they can present with blurring of vision also. So again, if any of these symptoms are present, consulting the doctor immediately is important along with the check of the blood glucose levels. So also, if the patient has been diagnosed with a cardiac condition, if the patient has been diagnosed with stroke, or if the blood circulation in the lower limbs has been found to be at a lower level, so also in these patients, checking a blood glucose is very, very important.